we are facing day-to-day very serious patient due to viral etiology, and we are labeled as a viral hemorrhagic fever. But in more than 50%, we found that in such a viral hemorrhagic fever, dengue serology, we are not able to detect the dengue serology. Still, we are suspecting that something viral is going on, and we are trying to manage, as we know, okay, viral fever can be managed with conservative thing. But if we try to find out other etiology, then we are able to pinpoint the diagnosis and may help the patient. Severe multisystem syndrome, damage to all our vascular system, symptom often accompanied by hemorrhage. There is a 4 different viral family, Arena, Philo, Bunia and Flavi, all are RNA virus. Unfortunately, they are very enveloped in lipid coating, and the versatility, genetic variety of the different virus in different epidemic area is so different. So sometimes we are also not able to diagnose with our routine ELISA or immunofixation or other method. We have to do a reverse transcripted RNA PCR. And survival is depend on animal insect host. Arena, some fancy name, we have not encountered such kind of fever in India. But in Munia viridi, Crimean Congo hemorrhagic fever, hantavirus, recently Ebola in South Africa, Tesanur forest disease. It is exclusive found in India, in Karnataka, and first isolated in 1957 in sea monkey. And dengue, as we know, yellow fever we are not usually encountered, but in traveler which travels to South Africa or America, they may encounter with yellow fever. First described in 1933, Argentina, Bolivia and Nigeria. Spread by rodent. Till up to now, we have not found any such kind of patient or diagnosed patient in our country. Virus can be spread through urine, feces and other excreta, human infection, contact with excreta, contaminated material, aerosol transmission. Person to person transmission is possible. So this is main reason for epidemic or pandemic of the disease. Africa, Lassa fever, South America, Junin, Mexico, Borneo and Sabina. Contact with rodent, case fatality is 35, up to 35%. And Lassa and Mexico fever has explosive outbreaks. Other varieties, Rift Valley, Crimean Congo and Hanta. Rift Valley fever, Egypt. Crimean Congo is in Crimean area, Congo area, Turkey, Pakistan and Rajasthan and India and Gujarat. More found in agriculture worker, Hanta in Korea. There is a different 350 virus, different genetic constitution of 350 viruses. Spread by Rift Valley is Aedes mosquito, as is in dengue. Crimean Congo is heart tick, Hanta because of spread by rodent, and less common route is aerosol. Rift Valley fever in animal, there is a chances of 100% abortion in animal. Mortality rate is more than 90% in young and older animals, 60%. Crimean Congo unapparent infection in cattle, sheep and cow and buffalo. Hantavirus is unapparent infection in rodent. So rodent can transmit the hantavirus. Philo is Marburg and Ebola. Marburg is European laboratory worker in 1966, first isolated. Ebola is in USA, Italy. Recently, there is a large outbreak in Africa. Philo reservoir is bad. Nosocomial transmission is very much documented. Reuse of needle, syringe, exposure to infectious excreta and hospital waste, aerosol transmission by primate to primate. Case fatality is 33% up to in Marburg, Ebola at 88%. And there is a different strain like Sudan, Zaire, and there is some fancy name in Africa. But transmission of pattern of disease is, they are suspected aerosol to aerosol, but exit is unknown. Most severe hemorrhagic fever, incubation period is 4 to 10. Fever, chills, malaise, all viral fever is course is same. Fever, then thrombocytopenia, then hemorrhagic symptoms, then liver failure, DIC. But if patient is survived, recovery is also very full because you routinely faces the dengue recovery. They readmitted after 3 months of dengue also. Generalized weakness, liver swelling, anorexia. Ebola virus has the highest mortality noted 82, and they will found in sick monkeys. Other varieties Phyli, dengue, yellow fever, OMSK, hemorrhagic fever, Casanova forest disease. Yellow fever 1648, 7 to 20th century dengue and yellow fever's outbreak is noted. 1957 we have a forest, Casanova forest in Karnataka, India. They found sick monkeys dying in rows, so they isolated such kind of novel virus and they give a disease. Till that Karnataka and India, they found this kind of virus. They transmitted by arthropod Aedes aegypti, Arctic, and OMSK is a big rat through urine, feces and blood. Yellow fever, non-human primate, varying clinical sign. Dengue, non-human primate, no symptom. Casanova in livestock, no symptom. In OMSK, no symptom. So noted that they harbor large number of virus in various host or transmission, but they don't even present with any symptom. So they are natural reservoir of the such kind of virus. Disease in human, clinical symptoms different slightly depend on virus, marked fever, fatigue, dizziness, muscle ache, exhaustion. More severe is bleeding, bleeding in organ orifice, and if patient can survive, then the possibility of mortality also. Diagnosis, if you are suspect the patient which is very much fitting with the viral syndrome, but we are not able to diagnosis by dengue routine method, then if you all know, they will send ELISA, but ELISA also negative. Then if you are suspecting specific viral induced etiology, then your specimen should be sent to National Institute of Virology, Pune, and they do a reverse transcripted RNA polymer chain reaction, and they are able to give result within 24 to 36 hours.
But not all the viruses.
But if you are suspecting like Crimean Congo, Hanta, Casanova forest disease, yellow fever, then almost they are doing extensive work in viral. Unfortunately, we have no specific antiviral therapy for all this disease, but ribavirin is useful as it decrease the mortality, but it's still not approved by FDA. And we was used to in a chronic hepatitis patient with ribavirin. In this the dose is 250 milligram, but in viral with hemorrhagic symptom with thrombocytopenia, 1 gram 6 hourly is recommended. IV ribavirin also available if patient is not able to tolerate oral ribavirin. Of course, strict isolation and healthcare notification is required in such kind of patient. Prevention and control, avoid contact with host species, rodent to control of rodent, insect to control of insect, and to prevent the insect bite by repellent clothing and barrier devices. Interesting area of research is vaccination. Yellow fever, there is established vaccination, but they are trying to found vaccination in antivirus dengue fever, but they are not able to conclude the or approved by FDA. In human cases, decreased person-to-person transmission and isolation of the infected individual till symptom is double the incubation period till the symptom and biochemical and blood marker is normal. Protective preventive devices, disposable gloves, shoes, protective eyewear, and there is a manual in Africa how to prevent and control of the such kind of problem. If patient is admitted, so we have to isolate, but we have to disinfect and dispose the used instrument. Chemical toileting is must for such kind of patient. 0.5% solution of sodium hypochlorite in 1:10 dilution. Recently we have one unusual patient which is dengue is twice, thrice negative, severe thrombocytopenia with severe bleeding.
Before that, if you isolate the patient, how the dengue spread will be? For that matter, other spread will be.
So they say is a mosquito bite to infected person to another non-infected person. Mosquito can transmit the
So
virus.
the mosquito net पर आत्मा 10 बार दिलो.
But it is not possible.
But
It is not possible.
But in dengue they are not possible. If patient is
net ni अंदर
Net ni ना.
but
that is what is isolation.
Same is true for falsifier.
બધા માટે true છે. ખાલી malaria માટે.
malaria and other viral fever.
I tell all the patients, please don't wear this short business. They are all wearing shorts, you know. So half of them get easily get bitten
એટલે
by
બહારથી
mosquito.
જે આવતા હોય ને જે
It is where through
પેલા
this season
countryમાંથી એ
it
લોકો માટે તો એક જ advice કે તમે
Fashion માં
take
બધા
care of
understand are
so that mosquito bite will be repellent.
I'm telling you, they wear these shorts and baniyan to sleep. They are more prone, you are sleeping, mosquitoes will bite you.
I don't know પણ કેટલાક મચ્છરને તો repellent જ ભાવે છે અત્યારે.
And now so they have started fabric repellent to avoid the mosquito. They are now marketing such kind of material. It's really working or not. One interesting patient come from Amod, Bharuch. He is actually Rabari cattle keeper and his platelet is 7,000, acute liver failure with a severe GI bleed and dengue is thrice negative. So just we think out of box and we send a premium combo viral isolation to Pune and they give result 24 to 36 you are positive. So in Madhya and South Gujarat almost reported first case and we treat with supportive treatment like platelet, other fluids therapy and hepatic supportive therapy and platelets. Patient recover after 12 or 14 days.
Liver functions are normal in
No sir, liver function is 9,000, 8,000. But bilirubin in initially normal, platelet is 7,000, 6,000. After giving so much platelet is just turn up to 12,000, 15,000.
And it is the vessel injury which is causing this.
અને RT-PCR થી what we usually do? Antigen કે antibody?
RT-PCR.
પણ antigen કે
RNA sir.
virus isolation. એટલે antigen.
And no sir, RNA virus. There is a and
But that usually present within 7 to 10 days only initial.
yes,
Yeah,
3 to
5
4 or 5 days. Yeah, then you will not get it. I agree.
See what you said is that what we are finding serious patients in dengue also is this.
yeah,
You give any amount of platelets, you do this. It
nothing
is
will
only auto self-limiting immunity of the patient which if it improves, it makes a turnaround. All this ultimately somehow gives a false, it's just a,
useless business to give
પણ એટલે
useless
નો
business.
business જ ખોટો છે સર એટલે
no, even if it pays what below 10,000 I am saying.
2,000 even I said 2,000. I have not used
2000 even
2,000.
reported zero means
If
cannot
you
be
do
clear માં દેખાય તો બી નથી
immature platelet fraction. And if your IPF is more than 7, so don't
Then
proceed.
sure 100% will 48 hours સાહેબ છે કે એ પ્રમાણે થઈ જ જવાનું છે તમારું
No, but even what we say is even IPF, you keep it on one side. Still you don't give platelets. or you give platelets, it is ultimately the patient's immunity only which will make a turnaround.
That is true.
It doesn't help at all. It's an eye wash.
આગળ પ્લેટલેટ આપવાથી કેટલાને ડેમેજ થયું છે ને એ બધું તો કોઈ રિપોર્ટ નથી કરતો.
Platelet antibodies થવાની જ બંધ.
There are so many reported cases કે પ્લેટલેટ આપ્યા પછી બધાને પ્રોબ્લેમ થાય.
અરે platelet antibodies થવાની જ બંધ.
But postpartum pregnancy, old age, already established bleeding, then if we just think of that, they might help, but we never know if platelet will helping him or not.
Bleeding that तो आपको ही पड़ेगी देगी मतलब
Sir, bleeding થઈને is a very slow bleeding. You can replace after 2 days with blood transfusion. So simple. It is not a massive bleeding.
ફ્રેશ બ્લડ.
A skin mucosal bleeding is not that severe enough. Because the way the hemoglobin have
See,
that.
people say that if the platelet goes less than 10,000, there are chances of intracranial bleeding.
But that is 0.3%.
Yeah.
That is 3 out of 1,000.
But sir,
You don't know
by giving platelet, you are not going to avoid that.
Avoid
No,
it.
why you want to take a chance?
No, sir. Yes, sir. By giving platelets, you are not sure that you are going to avoid that 0.3%. It doesn't help. But it is
It's true, but see, in a clinical practice,
You are
I have observed,
No,
if it
it's a
is less
patient,
than
we are
10,000, I have
patient.
given the platelet count start rising daily.
પણ સર નહીં આપો તોય વધશે.
But
નહીં આપો તોય વધે.
that's true, in certain patients I have not given, finally IPS.
That
And
doesn't
the
mean
platelet
that
rising.
આપવાથી
Don't come under
વધશે.
peer pressure of patients.
Yeah, peer pressure and your fear.
It is the anxiety of the relatives which dictate.
I said peer-
Ah,
No, I said peer-
fear of the doctor.
No, I said
It is
peer
fear of
pressure of
doctor.
patients.
Fear of the doctor.
That comes later.
The way I
But the
promote
dengue
my-
with pregnancy, one patient dengue with sickle cell crisis. Then we have to modify the thing. Because dengue with pregnancy, postpartum, sickle cell, then
Yes, ultrafiltration might be a better choice.
immunosuppression,
Ah,
maybe
then-
high off
હવે
level
એ લોકોનામાં
steroid.
platelet actually ગમે ત્યારે ગમે તેટલા હોય ને તોય bleeding થવાનું હોય તો થાય છે. 1 લાખે થાય છે.
હા, definitely, sir, definitely.
એટલે એની
Sickle cell
સાથે
crisis-
Extend transfusion.
Filtration.
And they don't use, they or even not recommended steroid, but when I was in Mumbai, my intensivist is usually used to use methylpred.
હવે એના પણ છે ને methylpred, even I have given, people do not respond that fast. Even after giving methylprednisolone, platelets have gone down. For subsequent for 3 days. I have given in plenty of patients. Plenty of patients methylprednisolone.
ના, ના, પપૈયાનો advantage છે. Moment you take papaya seeds, patient ખાતું હોય, ખાતું બંધ કરીને ઉલટી કરીને hospital That is exactly what has happened to the whole season. જે ડાયા થઈને લઈને આવ્યા ને એ બધા admit થયા.
First described in Crimea, also after 20 years in Congo, so their level as premium Congo outbreak continued to occur. Potential bioterrorist agent. Found geographical distribution in Gujarat and Rajasthan. First case is noted in Sanand, and one doctor and one healthcare nurses also expired in premium Congo fever before 12 or 10 years. Morbidity and mortality in human, seasonal trend, farmers, shepherd, vegetarians, laboratory worker, healthcare worker, and in Western country hiking and camping. Morbidity and mortality up to 80%, highest after tick bite, higher in some geographical area. Also affected availability of supportive treatment in hospital. This is the
How common is the ticks in the hospital?
sir, in sheep and cattle there is more common. સર આ રબારી અને ભરવાડ લોકો જે રાખતા હોય છે ને એનિમલ્સ એમાં આ એ લોકોને મેં ખાલી ચિત્ર બતાવ્યું હતું ડાઉનલોડ કરીને તો હા આ તો કે અમારે ઇન એન્ડ આઉટ બધાના ઘરમાં જ હોય છે ત્યાં તો દૂરની વાત છે અને એ લોકો સર જે ભાડામાં જ રહેતા હોય એટલે બાજુમાં એનિમલ રહેતા હોય પોતે બાજુમાં રહેતા
હા,
હોય ભાડામાં
ભાડામાં જ.
જ રહેતા હતા એ લોકો અને 70-80 ગાયો ભેંસો વધુ હોય છે એની પાસે
તમારા હોસ્પિટલમાં લઈ આવે ટિક્સ
મેબી
તમારા હોસ્પિટલમાં લઈ આવે
હા
when they get admitted it takes તમારા હોસ્પિટલમાં લઈને આવે
હા એટલે એના કપડાને બધું હાઇપોક્લોરાઇડમાં નાખવું પડે. It's a Hyloma species and spread by biting. Tick bite contact with infected crust tick. એટલે આપણે ક્યાં આવી જઈએ તો contact with infected animal tissue, ingestion of unpasteurized milk, contacted with infected people which has blood and tissue sets, horizontal and aerosol transmission not yet documented, but in large outbreak they also consider such kind of transmission. Transmission animal, viremic mammals can transmit virus to tick, bird resistant to infection. This is main reason to transmit one area to beyond large geographical traveling of the virus. Incubation 1 to 3 days after tick bite, if it is exposed to blood or tissue up to 6 days. Disease in human, fever, chills, headache, all constitutional symptoms, dizziness, photophobia, myalgia, nausea, vomiting, all non-specific, bradycardia and low blood pressure. In viral, usually we found bradycardia. And
Very frequent phenomenon. Bradycardia is a very frequent.
This time even we have found early on 40 records.
yeah.
Complete heart block is also
We used, one temporary pacemaker I have heard about that.
That was also in viral.
Right. But sir, patient presented with bradycardia, usually good prognosis, but if patient is presented with tachycardia in viral 120, 130,
It is myocarditis.
Myocarditis,
It is
then
myocarditis.
it's definitely somewhat worse prognosis as compared to bradycardic patient. Hemorrhagic fever, petechial rash, ecchymosis, hematoma, malign epistaxis, hematuria, hemoptysis, and really others. Recovery phase, generalized weakness, tachycardia, other non-specific symptom, and they used to say up to 1 year patient is complaining, and subclinical infection is uncommon. So we are not usually use any antibiotic in dengue
One
patients.
question, for the ticks, are there any insecticide or something?
There is they will used to use a chemical which is provided by free of cost by government to eradicate the ticks. So they spray in their houses and even spray over the animal also. But they don't use to do all these preventive measures. We notify this patient to health ministry, then they will go to their houses and they try to do all these things. But practically, how much effective and how much frequent they do is always questionable. Diagnostic viral isolation by reverse transcripted PCR, other is cell culture enamel evaluation. For healthcare person, biosafety level 4 is required to handling such kind of specimen. Diagnosis serology, not so much confirmative, then other serological test also they will try, but NIV can do reverse transcripted RNA PCR monitoring. Supportive ribavirin, there is no approval or no clinical trial to support this therapy. Passive immunization, they used to inject such kind of patients, such kind of inactivated virus to horse, and they try to remove the serum and use as a passive immunotherapy in Turkey. But still, it is not very helpful, or value of treatment is controversial.
Did you recover into your patients?
1 gram 6 hours.
Intravenous is it?
Intravenous is also available and oral is also available. The problem is that only we are able to found ribavirin because of some company has keep this stock because of liver problem, but the recommendation of hepatitis, liver disease is now vanished.
Which
So
chemist keeps it? Which chemist in Baroda keeps it?
lupin mani magare.
It is not safe to also nahi.
એ લોકો પાસે પડી જોઈ છે.
હવે એ તો બ્લોકિંગ હવે
હેપેટાઇટિસ
માત્ર એના માટે જ રાખે કે કોઈ વપરાતો હોય.
હવે તો આ સર અમને ફ્રી ઓફ કોસ્ટ જ મળી ડેફિનેટલી સર.
નથી
ફ્રી ઓફ
તારા
કોસ્ટ જ મળી પેશન્ટ.
ડોનેશન
So many species in wild and domestic mammals like cattle, bird mostly seronegative, reptiles rarely affected. Disease is animal asymptomatic, mild clinical signs possible in experimentally infected animal, newborn rodent, sheep and cattle. In animal, the same as they can do in human body, IG ELISA complement indirect fluorescence, viremia, not use diagnostic, prevention and control, tick repellent, environment modification, avoidance of tick habitat, examination of skin and clothing for ticks, clothing to prevent tick attachment, use of chemical which can kill the ticks,
Once in a while.
avoid contact with infected blood or tissue, wear protective clothing, gloves, food safety, don't consume unpasteurized milk, virus usually inactivated in meat by post-alter acidification, virus also killed by cooking. Strict universal precaution when using or carrying the human patient or his etc. Barrier nursing, isolation, gloves, face shield, goggles, prophylactic therapy, ribavirin, vaccine pipeline, stringent biosafety precaution. And 1% hypochlorite, thoroughly washing and chemical disinfectant is required. This is source we can find out such kind of SIDS and educational work. Thank you, sir. Thank you.
Good job done.
Very much, very nice.
આ તો બહુ પ્રીમિયમ વાળો છે.
हाँ sir, एक patient, 34 years.
તમે પેલું
Very Anuj, very Anuj.
Okay.
Sir, ત્યારે
आप फेसबुक पर से कार्डियोलॉजी
એની ભેંસ સાથે પણ પડ્યો હતો બધા. ભેંસ સાથે પડ્યો હતો.
એને પણ એની જ ચિંતા હતી સર, જલ્દી મોકલો એટલે મારે બધું જોવાનું છે.
અરે ભેંસ તો દૂધ જ ના આપે એના વગર. એ પણ એટલી જ હકીકત.
તમે
I
આર્ટિફિશિયલ
think
ઇન્ટેલિજન્સ મોકલે
we need a
second day.
monetization policy for doctors.
એ દરમિયાન
More
એ વાર એના 5 દિવસથી આવતો હતો.
એ દરમિયાન 3 વખત
ત્યાં પ્રાઇવેટમાં અનુસાર